Welcome back to the deep dive. Today, we're really getting into something intense, the world of endurance riding. I mean, it demands an almost unbelievable level of stamina from these horses. You picture it, right? Hundreds of miles, tough terrain, sometimes extreme weather. It's more than just a ride, it's a physical test, pushing these incredible animals, well, right to their absolute physiological limits. When they hit those limits, they face some serious challenges. Our deep dive today centers on two really critical and interconnected metabolic disorders: hypovolemia and dehydration. We're digging into some fascinating insights here, drawing from expert sources like excerpts on endurance horse health and metabolic disorders. So, our mission really is to unpack these conditions. What are they? Why are they so dangerous? How do you even spot them out on the trail or at a vet check? And crucially, how are they treated and prevented? We want these equine athletes performing safely. Okay, let's get into it. So, maybe to start us off, can we just get a basic handle on this? What is dehydration versus hypovolemia? And how are they linked in these endurance horses?
Yeah, that's a great place to start. They often get bundled together, but they are distinct. Dehydration, fundamentally, is about a lack of total body water. Think of it affecting everything. The fluid inside the cells, intracellular, and the fluid outside the cells, extracellular. For endurance horses, the main culprit is sweat loss. It's how they cool down, but the amounts are just staggering. We're talking like 10 to 15 liters an hour, maybe even more. And it's not just sweat. They lose water through breathing harder, respiration. Plus, sometimes they just don't drink enough. Maybe stress, the water tastes funny, or just not enough chances to drink. Now, hypovolemia, that's specifically about a drop in the circulating blood volume. It happens when there's major fluid loss from that extracellular space, especially from within the blood vessels themselves, the intravascular part.
Okay, so dehydration is like the whole body's water level dropping, but hypovolemia is specifically the blood volume shrinking. How does one lead to the other? What's the connection there?
Exactly. So the link is crucial. As a horse gets dehydrated, the body tries its best to compensate. It actually pulls water from the space around the cells, the interstitial space, into the bloodstream, trying to keep that blood volume up. But, well, there's a limit. As dehydration gets worse and fluid loss keeps happening, that compensation just fails. And that's when you get hypovolemia. And it's not just water. Losing key electrolytes, sodium, chloride, potassium. Way worse. It can even mess with the horse's thirst response. Like their body doesn't even realize it needs water anymore or can't hold on to it properly.
That's wild. So losing electrolytes can actually switch off their thirst drive? Does that mean just giving plain water might not be enough or could even sort of backfire?
It can definitely be insufficient, yeah. And in some really extreme situations, maybe counterproductive. Without enough electrolytes, especially sodium, the body just struggles to pull in and keep the water you're offering. That's why electrolyte replacement is so critical right alongside the water.
Right. That
Yeah.
makes total sense. Okay, so we see the demands, the basic problem. Let's trace it back. How do these conditions actually start developing out there? What are the usual suspects?
Well, the biggest one, obviously, is just the intense, long exercise itself. Endurance rides, by their very nature, mean massive sweat loss. That's the starting point. Then you have the environment, high temperatures, high humidity. They ramp up sweat rates and make it harder for the horse to cool off by evaporation. Direct sun doesn't help either. Another huge factor is simply not replacing fluids and electrolytes adequately during the ride. Horses often won't drink enough on their own to match what they're losing, or they don't get enough electrolytes. It builds up this deficit. And improper conditioning plays a role too. A horse that isn't quite fit enough might sweat less efficiently, or they tire out sooner, making them more vulnerable. Sometimes it's internal stuff like gut problems, colic, or ileus. That's basically the gut slowing down or stopping reduces water intake and absorption. Diarrhea, though less common, causes rapid loss too. Underlying health issues can be a factor, or even just stress. Competition stress affects appetite, thirst, increases metabolic rate, and honestly, rider factors are huge. An unfit rider, maybe the horse has a subtle lameness. An inexperienced rider not pacing properly or not recognizing fatigue signs, or even just not letting the horse stop to drink when it needs to. Pushing too hard, basically.
Wow, that's quite a list. It really drives home that it's often a mix of things, isn't it? If you had to pick one factor that riders maybe underestimate the most in preventing this, what would it be?
I'd say it's often that cumulative effect of not replacing electrolytes properly throughout the ride. People focus hard on water, which is essential, of course. But without those salts, especially sodium, the body just can't hang on to the fluid. And like we said, the thirst drive itself can get blunted. You can be pouring water in, but if the electrolytes aren't there, it's, well, It's not working optimally.
That's a really powerful point. And it's interesting. Our sources mention that Arabians and Arab crosses, usually between 5 and 18 years old, are seen most often with these issues, maybe just because they're so common in the sport.
That's likely a big part of it, yes. Their prevalence in endurance.
Okay, thinking about being out there, mid-ride, spotting the signs early must be absolutely vital. What are those critical red flags? The things riders and vets need to be watching for like hawks at those vet checks.
Absolutely crucial. Early recognition saves lives, truly. For dehydration, we look for several things. One is skin turgor. You pinch the skin on the neck, see if it snaps back in under 2 seconds, although that's a bit less reliable in really thin or really fat horses. Also, tacky or dry gums, mucous membranes feeling sticky. Sunken eyes can be another sign. Then there's capillary refill time, CRT. Press on the gum release and see how quickly the pink color returns. Longer than 2 seconds is a worry. Elevated heart rate, tachycardia is often one of the first signs you see. Over 60 beats per minute, a vet check usually indicates the heart's working harder because of lower volume. Severely affected horses, you might see 70, 79, even higher. Also look for less urination or none at all, as the kidneys conserve water. And just general depression, lethargy. The horse seems dull, exhausted, maybe doesn't want to move. Decreased gut sounds are another big one. Indicates the GI tract is compromised, often alongside no interest in food or water. Now, when it gets worse, progressing to hypovolemia, the signs ramp up. That CRT gets really prolonged, maybe over 3 seconds. That signals serious circulatory issues. Extremities, ears, legs might feel cool, the body shunting blood to the core. The pulse can feel weak, thready, hard to find because of low blood pressure. Gums might look pale, poor perfusion. You'll likely see faster, more effortful breathing too, as the body tries to get more oxygen around. Muscle tremors, weakness that comes from electrolyte imbalances and poor blood flow to muscles. Severe cases might show ataxia, stumbling, neurological signs. And the end stage, if uncorrected, is profound dullness, collapse, and shock.
That's a scary progression. You mentioned something fascinating earlier about hypoglycemic horses potentially looking sick but maybe not matching the classic dehydration signs. Could you elaborate on that?
Yeah, it's an interesting nuance. A horse with really low blood sugar hypoglycemia might look quite lethargic, maybe adopt this odd sawhorse stance. But, and this is the key, their heart rate, their CRT, their jugular refill time. They might not be as bad as you'd expect for a hypovolemic horse showing similar outward signs of being sick. It just shows how complex it gets metabolically. You can't just rely on 1 or 2 signs. You need the whole picture.
Right, it takes a full assessment. And under race conditions, time is tight. So how do vets move beyond just looking to actually measure the problem? How do they diagnose it definitively?
Good question. Visuals in the physical exam are always the starting point. But yes, objective measures are vital. Weight loss is one thing they can track, if possible. Losing 2% body weight suggests mild dehydration, 5% moderate, over 8% is severe. But blood work is really where you get the hard data. PCV packed cell volume and TP total protein are staples at vet checks. High levels mean the blood is concentrated because plasma fluid is lost. We look for PCV above maybe 45–50%, TP above 7.5–8.0 GDL, sometimes way higher, and actually looking at total protein and creatinine together gives an even better picture of fluid deficit than just hematocrit, because creatinine tells you about kidney function, which is often hit hard by dehydration.
Ah, okay. So it's not just blood thickness, but how the kidneys are holding up too.
Precisely. Blood lactate is another critical one. High lactate means anaerobic metabolism. Basically, tissues aren't getting enough oxygen, usually due to poor perfusion from hypovolemia. It's a major red flag for metabolic stress and potential organ issues. Then electrolytes, sodium, potassium, chloride, calcium, we measure these closely. Low sodium, hyponatremia; low chloride, hypochloremia; low potassium, hypokalemia are common with sweat loss. They contribute to fatigue, cramps, even heart rhythm problems. Low calcium, hypocalcemia, is often seen too. We also check muscle enzymes like CK and AST. High levels mean muscle damage, common in these exhausted horses. Creatinine, again, is often markedly high. And finally, blood gas analysis can show metabolic acidosis from that lactate buildup.
That is incredibly thorough. So you've got the diagnosis, often in urgent circumstances. What happens next? What are the immediate critical treatment steps?
Right, the absolute cornerstone is fast, aggressive fluid and electrolyte replacement. The goal is simple. Restore the fluid deficit, get that circulating blood volume back up, minimize oxygen starvation to tissues, protect organs, and get the horse back towards balance, homeostasis. For mild to moderate cases, you'd likely start with oral fluids and electrolytes. Offer fresh water, lots of it. Maybe try different buckets or add flavoring if they're picky. Give oral electrolyte pastes or solutions, the ones with sodium, chloride, potassium, to trigger thirst and replace losses. But always with access to water. Giving electrolytes without enough water can actually pull more water out and make things worse. Soaked feeds, like bran mash or beet pulp, are great for getting extra fluid in too. But for moderate to severe dehydration or definite hypovolemia, IV fluids are non-negotiable. Vets give large volumes of balanced isotonic crystalloids. Think lactated ringers, Normasol R, plasmolyte fluids designed to match the horse's body chemistry. Sometimes just 0.9% saline is used too. These go in fast, maybe 10-20 liters per hour in severe cases, through a large jugular catheter. Ideally, a longer catheter that's less likely to slip out if the horse is weak or collapses, and it should be sutured in place. All the while, you're closely monitoring heart rate, PCVTP, lactate, how the horse looks, adjusting the fluid rate based on response. And those IV fluids might be supplemented with specific electrolytes like potassium or calcium directly on the blood results.
So it's high volume, the right kind of fluid, tailored electrolytes, and constant monitoring. It sounds intense.
It is intense, and it needs to be. We also might use other medications. If calcium is low or gut motility is poor, calcium gluconate IV can help get the gut moving again. It can also stop thumps, that weird diaphragm flutter, if needed. Low-dose anti-inflammatories like flunixin. Well, they can be used if heart rate stays high and the gut isn't working, but only if the horse is properly rehydrated and kidney values are okay. You have to be incredibly careful with NSIs because of the kidney risk in these horses. Using them too early can cause serious kidney damage, even failure. If blood sugar is dangerously low, we give intravenous glucose. And if there's colic pain, especially with high creatinine, we use specific pain relievers that are safer for the kidneys while fluids are going. And of course, rest. Any horse showing significant signs is pulled from the race immediately for vet care. Once stable, food and water are reintroduced gradually, starting with palatable forage.
That's a complex rescue mission, which really underscores the importance of prevention, the old saying. So looking long before race day, what can riders and owners do to stop these conditions from happening in the first place?
Prevention is absolutely everything, and it starts way before the race. Proper conditioning is number one. Gradual, steady training builds fitness, makes their cooling system more efficient, helps them cope better overall. Acclimatization helps too, getting the horse used to the kind of heat and humidity they might face. Their body adapts. Good nutrition is foundational enough energy, balanced electrolytes in the daily diet. Then comes the race-specific strategy for hydration and electrolytes. Maybe some preloading, encouraging extra water and electrolyte intake in the days just before. During the race, offer water and electrolytes constantly. Every vet check, every hold, maybe even extra water stops between checks planned by the rider. And train them to drink from different things, troughs, buckets, hoses, and maybe with flavorings. Avoid pickiness on the day. Electrolytes need to be given strategically, always with plenty of water available. Use formulas backed by research if you can.
That training aspect is interesting, getting them used to drinking different things, practical stuff.
Exactly. Beyond that, it's about vigilance. From the whole team owner, rider, crew. Constantly watching the horse's attitude. Are they eating, drinking, monitoring hydration signs? Rider education, knowing your horse, is so crucial for catching subtle signs early. And finally, working closely with your vet. Develop a plan together, tailored for that horse, that race, those conditions. That's the gold standard.
Fantastic advice. So let's say a horse does unfortunately experience these issues. What's the general outlook, and what are the worst-case complications we might see?
Well, the good news is the vast majority, if treated quickly and correctly, recover really well, often with no long-term effects or need for follow-up care. But some cases are tougher. If a horse isn't responding well after, say, 4 to 6 hours of treatment, they probably need referral to a hospital for longer, more intensive therapy. Same goes if they have other major problems happening at the same time, like serious colic. And if something really severe, like a twisted intestine, is suspected, that's an immediate referral, emergency situation. As for complications, thankfully, less common with good care, but they can be devastating. Things like laminitis, that horrible hoof inflammation, and endotoxemia, which is a massive systemic inflammatory reaction, or even multiple organ failure. In horses that sadly don't make it, post-mortem exams can show damage to the heart muscle, kidneys, the laminae in the hooves, brain swelling, or areas where blood supply failed in the lungs or gut. It really highlights how systemic and serious this can become if not managed properly.
This has been incredibly insightful. It really hammers home that understanding this isn't just, abstract equine health. It's about appreciating the sheer athleticism and the very fine physiological line these animals walk under extreme stress.
Absolutely. And knowing the details, thinking critically about why these things happen, how the body responds, That knowledge is powerful. It gives you insights that maybe go beyond just horses,
Yeah.
about adaptation, limits, the body's amazing, but fragile balance.
Which leads us perfectly to a final thought for you, our listeners. Think about other extreme athletic challenges, human or animal. Where else is such precise fluid and electrolyte management absolutely critical for survival, let alone success? How might what we've learned about these incredible horses apply more broadly to how any athlete pushes their limits? Something to ponder. Thank you so much for joining us on this deep dive into endurance horse health. We'll catch you next time.